So are you having trouble breathing through your nose? A lot of people are quick to assume it could be sinuses or maybe just allergies.
But it could be something much more. So how can you find relief and start breathing again?
Dr. Jessica Moran-Hansen of ENT Consultants is here to fill us in on all that. Good to see you, doctor.
Good to see you.
Is that one of the most common questions you get? No, it's good to have you here. Is that one of the most common questions you get? Now, why can't I breathe through my nose?
It really is.
Is that it?
Yep, I would say people come in often and their complaint is, I just can't breathe out of my nose. And they usually attribute it to, the most common things like sinuses and allergies.
Right.
But sometimes there can actually be something physically blocking in your nose that would require some form of surgery to fix.
What kind of things could be happening?
So oftentimes, it's sinuses or allergies. We can kind of rule that out. But if you're having something physically wrong in your nose, as you can see on the diagrams here, you could have a deviated septum. That's that divider that separates the right from the left nose. If it's off center, it could definitely be blocking one side of the nose. Turbinates, they're kind of like these big hot dogs, I always call them, that live on each side of the septum. Sometimes when the septum goes off to one side, that turbinate on the opposite side could get really big, and then it could be causing blockage on the other side of the nose. Also, you could have something we call nasal valve collapse, which is kind of like a skinny nose or a narrow nose, and that's kind of when the outer cartilages of the nose kind of narrow and fall in a little bit.
So what can you do about those? I think most people are familiar with deviated septum.
Well, I had a question about that.
Yeah.
Does that happen? Does that ever happen naturally, or is that from getting hit, or how?
Both, yeah. Sometimes
Both?
people
Okay.
come in and they remember exactly, when they got hit or had football
Right.
injury and they had a deviated septum. But also times people are just born that way, and it can be severely deviated without any form of trauma. And that's something we can easily diagnose when you come into our office by just looking in the nose usually.
What's treatment like for that, for a deviated septum?
Right, so that usually requires some form of surgery. It's bone and cartilage that's off center, so there aren't really any medications that we can use to move bone and cartilage. So it usually requires some surgery, and it's an outpatient procedure where we go in and we actually take that deviated portion of the bone and cartilage, move it back to the center, and give you a nice airflow on both sides of the nose.
That's gotten a lot better over the years, though, hasn't it? I remember 20 years ago hearing people get a surgery on their deviated septum, and it was like you're in bed for like weeks or something.
Exactly, I agree.
Isn't it gotten a
would
little
say
better now?
People often have a really bad horror story about it from somebody who had it way in the past. It's a very easy procedure, I would say nowadays. In and out.
Yeah.
You don't have to stay overnight in the hospital. Maybe a few days off of work. No heavy lifting, that kind of things. But it's nothing as severe as people said in the past. I would say.
Right.
Now, what other kind of treatment options do you have? Is it all surgical?
So, if it's sinuses and allergies, then yes, we can usually do some form of medication treatment. But if there is something anatomically blocking your nose, then it usually does require surgery. So we talked about those turbinates. Those are like the big hot dogs that live on each side of the septum. And we can shrink those down for you. Sometimes we can do that in clinic, or sometimes we can do in the operating room, especially if we're doing it in combination with other procedures like repairing the deviated septum and things like that.
Yeah, there's a new implant called Latera, right?
Yeah.
How does that work?
So if people have kind of a narrow nose or nasal valve stenosis, as we call it, oftentimes people will come into the clinic and they usually just kind of pull on their cheek skin over the side and say, I just want to be able to breathe like this all the time.
Just open those airways
Exactly,
up, right?
Yep. And so another way you can know if you have it is kind of look in the mirror and then take a deep breath in and notice if the sides of your nose kind of shrink in or suck in a little bit.
Yeah.
Those are all signs of nasal valve stenosis. And so there's this teeny tiny little implant that we can actually insert just along the sides of the nose. Not as big as procedures like an open septorhinoplasty like plastic surgeons do. Here's a good
this the
example.
procedure?
Yeah. It's just this little implant, I know it looks like a big needle, but it's just a little needle. It inserts it along the side of the nose and can open up that nasal valve area so that you don't have all that collapse when you're breathing in and out.
That stays in permanently, or?
And it will dissolve over 18 months,
Okay.
but the goal is to not change the outside appearance of your nose in any way. So when they did this, in all the research studies, they showed the pictures to a plastic surgeon afterwards, and maybe a very, very small percent, at least less than 10%, had any form of change to the outside shape of their nose. So that's kind of the best part of it, is it improves your breathing without changing the look of your nose.
Now, if that dissolves within 18 months, does someone have to get that procedure done again? How does that work?
And so that's one thing that we're learning here. So we think that the scarring should last afterwards, but if not, like I said, it is an easy implant that you can also just re-inject if after 18 months you start to have some failure and you need it implanted again.
Yeah.
Okay.
What's the downtime on that, and how uncomfortable is that?
Yeah, so the patients that I've had done so far, minimal downtime, Sometimes they have a little tape on their nose afterwards. That's just to remind you not to mess around with the implant. But usually, if you just have the implant done, you could go back to work, I would say, within a few days. Again, outpatient procedure. If you wanted to, we could always try doing it in the clinic too. So a lot of these things you don't always have to go all the way to sleep for in the operating room. Sometimes we can do these things in the clinic for you too, which is then, again, even less downtime.
That's nice.
Yeah.
And that's what a lot of people are concerned about. They put a lot of these procedures off because they're like, well, I'm going to be out of work for a week, or I'm going to be out of work
Very
for 2
common.
weeks. But now that you've shorten that time to
Right.
heal, I think a lot of people are getting those procedures
Yeah,
done.
I think that is something people are always like, I'm going to have to take months off from works after I have this done. I'm like, no, a lot of these things, like I said, we can do in the clinic if we needed to with minimal downtime, or even the outpatient procedures. Again, minimal downtime for surgeries, which is
Right.
different than, like you said, in the
Yeah.
past, if
Yeah.
people
Right,
have all
right.
those
Yeah.
bad horror stories
bad.
about nose and
People-
sinus surgery.
People watching right now who may be interested in this are probably wondering, well, how much is this going to cost me?
Mm-hmm.
Or, does insurance cover any of this?
Yes, and so these aren't, plastic surgery procedures where we're trying to go in and just make your nose look beautiful. We're
Right.
trying to improve the function of your nose.
Yes,
So it's always
it's
between
different.
you and your insurance company, but these aren't considered, elective aesthetic procedures. They are something that insurance usually covers because we're actually trying to improve your health and the function of your nose.
Yeah.
So different than a plastic surgery type procedure.
It's not strictly cosmetic.
Exactly.
How do
not
people get the ball
cosmetic.
rolling on this? Do they just come in for an examination? Or how-
Exactly. If you're having problem breathing with your nose and you've been dealing with it your whole life, with most people have, all you got to do is give us a call. We're going to get you in either the same day or the next day if you want. That's kind of our goal, is to get you in, get you seen, and we can tell you what's going on with your nose. We have a CT scanner in our office, so we can always do that, go over the images with you. Just a lot of stuff that we can do right there while you're in the office to let you know what's going on.
How many people have put this off and off? They've lived with it their
Yes.
whole lives, and finally they're like, the procedures have become a lot easier and a lot better, and now they can do it. Your main office right there on 144th
Oh, yeah.
Street, right in Oakview, right?
Yep, very close. Yep.
And give them a call, 402-778-5250, or check out omahasinus.com for more information.
Doctor, thanks for
you
coming
so
in.
much.
A lot of
Thank
great
you,
information.
guys.
We appreciate
Yes,
it. Yeah,
No, please give us
Absolutely.
a call. We're glad to answer any questions you guys have.
yeah, you
Thank
betcha. Good to see
you.
you.
Yeah.